The information shared on this podcast is for educational purposes only and should not be considered medical advice. Please consult a qualified healthcare professional regarding your individual health needs. You already know I don't believe in shortcuts. If you're not lifting, walking, eating enough protein, managing stress, and prioritizing sleep, peptides are not the answer. Lifestyle is the foundation, always. But here's the truth. Midlife biology can be stubborn. Hormones shift, recovery slows, body composition changes, and energy dips even when you're doing the work. That's where medically supported peptide therapy can be layered in, not as a replacement for discipline, but as strategic support. Physician prescribed, clinically guided, compounded through an FDA-regulated pharmacy. This is about optimization, not escape. If you've built the foundation and feel like you've hit a wall, this might be the next intelligent step. Lifestyle first, strength mandatory, support biology when it needs backup. If this resonates, send me a message and let's have a real discussion, or check out the link in the show notes. Health, wellness, fitness, and everything in between. We're removing the taboo from what really matters in midlife. I'm your host, Michelle Folan, and this is Asking for a Friend. We spend a lot of time and money chasing good skin, the right cleanser, the right retinol, the right serum that promises to turn back time. But what if the real conversation isn't about glow? What if it's about survival? Today's guest is someone who has built a reputation as the no-nonsense dermatologist best friend you wish you had in your group chat. She's practical, she's accessible, she cuts through the noise and tells you exactly what works and what's just expensive hype. But this conversation hits a little differently because she's not just talking about melanoma from a clinical standpoint, she's walking through her own melanoma diagnosis right now. So today we're going deeper. We're talking about what melanoma actually looks like and how prognosis changes by stage, what every woman should know about skin cancer risk. And we're also going to talk about skincare advice you should ignore, drugstore gems and splurge-worthy products, hair loss in midlife and what actually helps, and the procedures that truly are worth your money. If you've ever felt overwhelmed by skincare advice, if you've ever brushed off a changing mole, if you've wondered what hype is and what's real medicine, stay right here. Dr. Brooke Jeffy, welcome to Asking for a Friend.
Thank you so much for having me.
It's really nice to see you. I was telling Brooke that, I've been following her for quite some time, and it's always so fun to see people in real life on right here in podcast land. So anyway, it's really great. So for those meeting you for the first time, what led you to dermatology? Was that always your plan?
Definitely not. There were actually a lot of steps along the way where I kind of tried to talk myself out of being a physician. And I definitely had no idea when I started medical school that I would ultimately be in dermatology. I definitely had a strong interest in medicine growing up. I actually had another chronic condition that I grew up with. But, medicine is a long, hard road. So I really tried to figure out other careers that would make me happy. But ultimately in college, did decide to pursue medical school. But even after going through medical school, I actually did 2 years of pathology residency training because I really wasn't sure what I wanted to do. And pathology lets you interact with a bunch of different conditions and, different specialties. So it was through that exposure, actually, looking at pieces of skin under the microscope, that really was my first introduction to dermatology. And through that, I got to spend some time in the clinic and pivoted.
All right. So that's really fascinating because I was going to ask you if the pathology kind of led you down that path of dermatology. And dermatology residencies, those are hard to get because there's so few of them, correct?
Very true. I was very fortunate to be able to make that change and even get in, to a residency, a derm residency program. I did not get in the first time. Did some, actually worked in a pathology lab as I waited to apply again. But that's kind of a typical scenario, that just really demonstrates to the program that you're dedicated. You don't just decide to pursue something else.
Right. And you have built such a great reputation on Instagram. I have to tell you, you are really the no nonsense dermatologist best friend. I said that in the intro. Where does that approach come from?
Yeah, so I'm from the South. I'm from Kentucky, and I feel like I've always just liked to make people feel at ease. I feel like kind of hospitality and feeling comfortable is important. I really like talking to people and like getting to know their story. And with medicine, that's great because there's just a lot of relevant things that you pick up when you have a conversation with somebody. And then, I kind of have always just been very no nonsense, which has led itself well to social media because people are really just like, they want the facts and then to keep scrolling and move on. So it serves me well, I guess.
Well, it does. And I know there have to be some things that frustrate you about the current skincare conversation online. What are those things?
Definitely. I mean, one thing that I find really frustrating is just there's so many voices out there that often just don't make sense to me why they're even in the conversation. Influencers, just kind of trying to make a name for themselves or like push products. There's a marine biologist that I see all the time talking about skincare. And I'm like, what are we doing here? There's definitely people who are well suited to talk about this. And those should be the people with the loudest voices. I also think in a large part of the skincare conversation or just skin health that we miss is not talking about protection enough, but also just the relevance of the rest of our life choices. What we decide to eat, how we decide to take care of our bodies in terms of like adequate sleep and avoiding alcohol and things like that. All of those things play a role in helping our skin look and feel its best and also being able to defend itself against exposures and resist things like cancer development.
I interviewed a integrative health doctor this morning. And of course, everything goes back to lifestyle in so many ways, right? I mean, it's the whole body approach. And dermatology is not limited to just skin. It's really what we're putting in our bodies and how we're treating ourselves. So that's really a cool perspective. I like that a lot. All right. I want to hit this topic out of the gate with you because you are currently walking your own melanoma journey. And I would love to know how you found it because you are a dermatologist. I didn't know if you do your own self-exams. And then walk us through what your mindset was when you got the diagnosis.
Yeah. So, I mean, I will say I've been saying for many years that I felt like I was probably going to get a melanoma. So I grew up going to tanning beds very often. I worked in a tanning salon. When we didn't have customers, I would like prop my legs in there and just, study or read or whatever I was doing. I loved being at the beach. I thought it was so fun to get like a burn and be able to peel off that skin. I mean, then I go to medical school and I really felt like, this is going to happen to me. The question is just like, when? So I've been very diligent watching my skin in light of this. I mean, I've been strictly protecting myself for like close to 25 years now. So just watching things. Occasionally I have had skin exams. This is bad. I have had skin exams by other people, but often it's just me, keeping an eye on things. And so what happened was I noticed a new spot that popped up on my left calf. And that's important for people to understand. Most melanoma actually does come up as a new spot. It's much more common than having a mole that you've had longstanding develop, change into melanoma. So I noticed this new spot. I watched it for a few weeks. It just looked off. It looked different from most of my other spots, of which I have a lot. And that is something that dermatologists refer to as like the ugly duckling sign, something that pops up that looks different than all of your other spots. And so I actually biopsied it myself because I was like, okay, I need to get this done, but hard to like get in on somebody's schedule and take time out of clinic. Like I can reach this. Let me just do it. So I did that. So yeah, basically I received the report myself. Actually, the pathologist called me because obviously they knew me and saw me as the patient name. And so she called to give me the diagnosis and chat with me about exactly what she was seeing. So, I mean, it's scary, but and even sometimes people, since I've been sharing online, have been kind of saying, well, like you just seem like very comfortable with it. I wouldn't say I'm comfortable, but it's something, like I said, that I've lived with, thinking was probably like I have all this risk. So I've kind of sat with it for like a really long time. And then obviously I diagnose people with this all the time. And so there's almost like a comfort and like almost a detachment sort of that allows us to survive, I guess. But definitely it's scary and obviously something I'll be taking seriously and continuing to get like more routine exams with someone else to be sure that I am seeing everything. But I do feel, it wasn't the earliest, but it was still very early. So I feel very confident that as long as I keep being vigilant, hopefully things will be fine.
So how has this experience personally changed now how you will practice medicine?
Yeah, I mean, I definitely have a different appreciation for people I give this diagnosis to. I just earlier this week, I had a conversation with another young woman, middle-aged woman, who I did a biopsy of last week and came back as a melanoma. And yeah, that conversation was the first conversation I've had since my diagnosis, and it definitely was harder. Just the kind of empathy and like knowing what she has ahead of her. So I think it's going to make me a more like empathetic, physician in that aspect. But again, like just to be real, to be a physician, you have to have a little bit of a wall, right?
Yeah.
Otherwise, if you can't survive. Like you have to protect yourself a little bit, but I definitely can see that it has, I guess I'm going to say cracked a little bit.
We have not really talked about melanoma much. I mean, I've had plenty of dermatologists and plastic surgeons, that sort of thing on the show, but we've not really dug into this. And what early signs do we typically ignore that we shouldn't as women?
Well, skin cancers are challenging sometimes because very often people will dismiss them as like even pimples. Like sometimes a skin cancer called a basal cell skin cancer can often look like an acne type of bump. So they'll kind of brush it off. So what I tell people is like, try to keep an eye on things. If you notice something that pops up, it seems like it should heal, you think it's an acne bump. If it's not gone in like a month or so, you need to get it checked out. I mean, nobody's missing these giant, pictures online you see of melanoma where it's like 4 colors and it's bleeding. I mean, you're not going to miss that. But things start out much more subtle often. So you just kind of have to be vigilant about that. Definitely keeping an eye on your skin. Just if you notice anything off, I think you've got to question it. If you're someone who's had a lot of exposure, you did tanning beds, you had blistering sunburns, get checked periodically. That's something that's come up a lot with people since I've started sharing my stories. They think, oh, well, like I stopped doing that. I haven't done that in 20 years or whatever. It doesn't matter. Like your DNA is already damaged from that. So yeah, it's just really watching, asking questions.
Yeah. So my story, I had a stage 0 melanoma 4 years ago, I think it was. And so I still go every 6 months. I go this month, as a matter of fact, to get skin checked. Now, that was stage 0. Yours is stage 1, correct? Okay. What would be the difference in your approach from stage 0, stage 1 to 3? Like, talk us through that.
Yeah. So Staging for melanoma relies on certain characteristics that we see under the microscope or that we assess clinically. So under the microscope, we're looking for things like how deep is the melanoma? So for example, your in situ melanoma, what that means is that those melanocytes that are the cells that give us pigment in the skin, those are what become malignant to cause melanoma. So they're usually in like the very base layer of the epidermis, which is like the uppermost layer of the skin. Underneath that, you have the dermis. So if those melanocytes that are malignant, if they're staying in the epidermis, that is melanoma in situ or stage 0. Once they break through the epidermis, they're in the dermis where they have access to other things like blood vessels. That is where you get higher stages. So the depth matters. And even once it's broken through that into the dermis, we still take measurements beyond that. And that, again, influences where we stage it. But it's the depth. It's also ulceration. So a pathologist will always comment on whether the tumor has ulcer under the microscope. And then the other things we evaluate when we're staging would be in deeper melanomas. Does someone need to have their lymph nodes checked with something like a sentinel lymph node biopsy? Or do they need to just have their lymph nodes removed because it's a high enough stage, and then distance spread, like has it spread to other places in the body? So as you can probably imagine, stage 0 is going to be much less risk overall to someone. And essentially, if you have an excision, it is essentially cured. I think like the 10-year survival for that is 99% of people who have it excised will still be alive at 10 years. And those numbers, of course, like go down as you go up through the stages. So most of the time, you're going to have the lesion excised. Whether or not other evaluations are done depends on the depth, and then of course treatment. So things like stage 4 melanoma, I mean, you're going to be talking about like chemotherapy and immunotherapy, things like that. So it's kind of nuanced. Even within these stages, there's different levels, but that's sort of like the spectrum. So basically you go from like almost 100% being cured if it's removed to like stage 4, which is about 40% survival if you do like all the aggressive therapies.
Holy shit. I mean, that's scary. That's scary stuff to me. I think about people who in my own life who I know who have had it and have not survived it. But so we talk about lots of sun exposure in our younger years, tanning beds. Is there a hereditary component to this?
There is a hereditary component. There are definitely some genetic abnormalities that can be associated with melanoma and often with some other malignancies that kind of like that are sometimes associated with it. But it doesn't mean that every person that has melanoma is going to have, a genetic abnormality that we can test for. So I don't honestly, I mean, when I'm talking to my patients, it's kind of a discussion. Do you want to have genetic testing done? Do you want to know those, if there's associated risk of other things like breast cancer, colon cancer, pancreatic cancer? But like in reality, like you've got to get screened for all those things too. So it just might affect how aggressive and how frequent you are screening.
I just remembered this. A friend of mine, childhood friend, her father was Arab and he died of melanoma. Mm-hmm. So it doesn't matter if you're pale with freckles or if you're a very brown skinned person, correct?
That's correct. It absolutely doesn't. And the thing is, I think part of that is that people with more pigmented skin, they don't think they have the risk. And it often is detected much later when it is detected. So, I think that's just in the background of it. Also, people, certain people with, different access to care is going to be influenced. They don't think they need skin exams, or it's harder for them to see a dermatologist. So all these things definitely play a role, but nobody's risk is zero, I think is like the takeaway. But certainly there are people who are going to be a bit more at risk, like you said, if you're fair skin, if you've had a lot of blistering sunburns, done tanning beds, that sort of thing.
All right. Dr. Jeffy, we're going to take a quick break. And when we come back, I want to talk about sunscreen and prevention. Before we jump back into today's conversation, I want to ask you something. If you've been listening for a while, you know this podcast isn't fluff. We talk about muscle, metabolism, hormones, brain health, longevity, the stuff that actually determines how we live in our 70s, 80s, and beyond. And the show keeps growing because you share it. So if an episode has helped you rethink your health, send it to a friend. Text it to your sister. Share it with your walking buddy. That's how this community expands. Smart, curious women bringing other smart, curious women with them. Also, I'd love to hear from you. What topics do you want me to explore? Who do you want me to challenge? What questions are you afraid to ask but secretly want answered? You can use the link in the show notes to join the community or send me an email with your ideas directly. This podcast exists because you're asking better questions. All right, let's get back to the episode. Okay, we are back. Before we went on break, I said I wanted to talk about sunscreen. I know you are a big fan. I think there's a lot of misinformation out there about the safety of sunscreens, and help us out here. What should we be using? What should we be looking for in terms of ingredients, and how often should we be wearing sunscreen? And I think I know the answer to that, but
Yeah. So I would say that you want to think about how you're protecting your skin every day. I do recommend that people are wearing sunscreen on exposed skin like every day, even if it's winter, because part of it is like the habit portion of it. Part of it is if you're busy, you think you're at home, but then like something comes up and you need to leave the house, like then you're not protected. So it's good, I think, to just like at least get an application on in the morning, get it out of the way. Of course, there is a lot of talk and concern about sunscreen ingredients and chemical sunscreens versus mineral sunscreens. And, I think the bottom line is you have to be comfortable with what you're doing. If you kind of want to avoid most of the controversy, you rely more on sun protective clothing. Unfortunately, though, you can't wear like a mask. And I'm not saying I agree with the controversy. This is like a very long kind of discussion here. But, you can't wear a mask on your face all the time, most likely. So you have to come up with something that at least you can use on your face. And then maybe you focus on some protective clothing. Maybe that feels more comfortable for you on the rest of the body. So then you're like minimizing the use of this product you're rubbing on. But yeah, if you want to kind of avoid the controversy, mineral sunscreens, the issue is that chemical sunscreens, we do know that if you are using them really consistently on large parts of the body and you're using enough of them, which are a bunch of ifs because most people do not use them as intended exactly. But if you were, studies show you're doing that for multiple days in a row, it can be measured, the chemical sunscreens can be measured in your blood. We don't know what that means, if anything, but that idea bothers people. Mineral sunscreens are not. So you can just avoid the whole thing. And mineral sunscreens are titanium and zinc. Everything else is a chemical sunscreen. So just use something that has a mineral filter and feel good about it. Try to protect yourself, with some protective clothing. It's really hard to keep sunscreen on all of our body. It's messy. You got to reapply it frequently if you really want that protection. But I am also someone that I love to be outside. And, I think we do need sunlight in our lives, right? I'm not someone that's saying you should be a hermit and stay in to avoid the sun, but you have to do it smart and you have to be protecting yourself using the shade, that sort of thing. But light is important for our circadian rhythms. We're learning more about it in the longevity space. So you just have to think through the strategy. This is obviously something I'm super passionate about. I love talking about sun protection strategies for people.
Well, and I wear sunscreen on my face every day. Now, is that for cancer prevention? Probably not. It's more for vanity. But if you
that works.
Yeah, if you just think of it from, look, I won't, maybe my knees won't look saggy when I'm 82 and my face will look somewhat decent. My mom, I will say this, my mom always looked younger than what she was because she wore sunscreen every single day on her face. She also used Vaseline on her face every day too, which is a whole nother story. But, that's encouraging to me. And because my dad was a redhead with freckles, we all are freckled and we always wore sunscreen even as kids. Now, that didn't mean we didn't have burns, because I did have plenty of burns prior to that. But, we keep our fingers crossed too. But I think just from the vanity perspective, if we can just get people thinking in those terms. But you're saying, though, if we are out taking our daily walk, whatever, we should be at least covering up, if not wearing sunscreen.
Yes. I mean, I think the covering up is what you rely on because it's more full protection. You don't have to reapply your hat. It's on your face. I mean, it's on your head.
Right.
But, like I said, just there are areas you can't cover. So then, you do need to have a sunscreen strategy as part of it. But I love what you say about the vanity. Yes, that's usually how I try to appeal to people, is because like you're coming in, most people, they're not happy with their brown spots. I'm like, okay, well, we're not going to get anywhere unless you're being really strict about the sun protection. So definitely the vanity is a useful way to convince people too.
Yeah, well, that would be me. So, all right. There is so much advice out there. Instagram, TikTok, lots of red flags, as we were talking about. There are a lot of people that really shouldn't be giving advice or are out there giving advice. What, in your mind, are the true non-negotiables for an effective routine?
So, of course, sun protection, number one. You're not getting anywhere without that. Then I would say a retinoid. So whether it be an over-the-counter product, a prescription product, but a retinoid will help to maintain your collagen. It will also help with pigment changes. And then the other non-negotiable, I think, is an antioxidant type of treatment. So very commonly, this will be like a vitamin C that you're using with your sunscreen in the morning. These I am referring to, because I talk a lot about kids' skincare. I'm talking about adults here, but these are non-negotiables to me that are evidence-based. I also would add peptides. Those are like the fourth thing I would add in a complete kind of regimen for an adult trying to maintain healthy skin.
Okay, so let's back up to the retinoid. So there's tretinoin.
Mm-hmm.
Are there any over-the-counter dupes that are worth their money?
Absolutely. I mean, you don't have to have a prescription tretinoin to get benefit to your skin, from a retinoid. So over-the-counter retinols they can be as effective. Studies show as long as you're using, I think it's the 0.25% retinol, it's equivalent to the lowest strength tretinoin in terms of benefit over 12 weeks. So, you don't have to have a prescription. And the issue with the prescriptions a lot of times is that sometimes they will be a little more irritating to the skin. So an over-the-counter retinol might actually be a little bit more tolerable for a lot of people. So there's also adapalene, which is another over-the-counter retinoid, more studied for acne, but it used to be a prescription and now you can get that over the counter. But people do use it for anti-aging. It probably does, have an equivalent benefit, but more studied for acne. So there's definitely over-the-counter options.
Was that different?
Yeah, that was different.
Okay. And then in terms of, a favorite brand of over-the-counter that you think is effective?
Of a retinol?
Mm-hmm.
I point people to that Rock brand. CeraVe has a retinol now. I mean, there's obviously much more expensive brands that have retinols too, but I think the bottom line is to be sure it's like a reputable company. But I think, there's a lot of options out there, but those are usually the two that I point out to people.
All right. And then I know La Roche-Posay is a nice brand. I always feel fancy when I'm buying a little La Roche-Posay. But there's a lot of Korean skincare products out there, K-Beauty. Is there really a difference between those products and what we typically have here?
So I'm very excited about this topic because my husband is actually in Korea right now, and he was just walking me down the aisles of beauty at Costco yesterday via video, and amazing to me, like just how many products. But yes, I do. So the philosophy to skincare is different. It's more focused on hydration and, simplicity kind of in terms of the ingredients, more natural ingredients, things like snail mucin and centella. I mean, so it's just a different focus, where in the US, it's more like actives to try to like correct and treat things. So they're just like more barrier focused. I do find it very fun. And I do think that they do different things. There's different delivery systems. They focus a lot on masks and essences. So I think they're fun I think some of those products are very fun to incorporate. And I do think we're seeing a shift in US beauty to more focus on skin barrier health and hydration. So it's interesting how I think that's influenced us over the past few years.
So I have used some K-Beauty, and I think there is definitely like a glassy kind of look that you get. And I noticed, I was in Europe this summer, and a lot of the Korean women were there, and they're all covered up, like arms, hats, face masks, the whole deal. But when you did get to see one that wasn't covered, their skin looks incredible. I mean, obviously they don't get the sun damage.
Yeah, I think that's the issue. It's a combination of the fact that like they're staying super covered, right? So that keeps their skin barrier working really well. They're not having as much pigment problems. And then they're coupling that with these like really hydration, like skin drenching type of ingredients. And it does help you get, that glow. My favorite type of K-beauty product, like I love snail mucin as an ingredient. It just imparts that glow onto your skin.
I've noticed even in the US, we're starting to see some Korean products at Costco. So I bought some eyelash serum, and I don't know if it's working, but
Okay.
Jury's out.
I haven't delved much into the eyelash serum, so that's going to be interesting. I should do some research there. I think you just have to be a little careful with like, is it actually the same product? I definitely with like the sunscreens, it's not the same product that you're getting, because in the US, the sunscreen filters that are available there, are not approved by the FDA. And then I just think, it might be possible that they're tweaked a little bit to be on the US market.
All right. Well, and I guess we see that with everything, right? Even some of the really nice European brands, like even La Roche-Posay, probably wouldn't be the same as what you would get elsewhere. All right.
Exactly.
Okay. I want to know, what's the correct way to remove our makeup at night?
So I am a big fan of a double cleanse. I know some dermatologists don't think this matters, but especially, honestly, I don't even want to say especially for women. I think for anyone who's wearing sunscreen, but of course also if you're wearing makeup, like most cleansers, even though they say removes makeup and sunscreen, like I just don't think they do. And I've kind of tested this myself, where I pretty much just wear tinted sunscreen, but I've used some of these cleansers, and then I will take like micellar water or something and cleanse, use it afterwards. And there will still be things on that pad. So I do think it's important to use a makeup remover first. I like micellar water, or if you have drier skin, a cleansing balm, even Vaseline you can use, and then do your cleanse after that to be sure you get everything off before bed. And that is another non-negotiable. You got to get everything that you've put on during the day, dirt, oil, pollution that's accumulated on the skin. You got to get it off before bed.
Oh, amen. Woo! Yeah, I'm big on the nightly cleanse. I don't care how tired I am. It's coming off. Gotta get it off. Okay, good. All right. I get 1 point. Yay. I know you have a whole list of unsexy products, and we're talking your standby over-the-counter stuff. You said Vaseline, which I know is one of them. Which are your favorites that deliver consistent results for you?
My top unsexy product is Vaseline. You can use it for everything. Take your makeup off, fix your, cracked heels, slug if you've overdone, your retinoid at bedtime, or it's winter, you've got eczema. The proudest moments I have as a mom, I have a 16-year-old son now, but when he has anything going on with his skin, he's like, should I just put Vaseline on it? I'm like, yes, you should. That makes me feel good. Minoxidil is another just like super cheap and easy product that helps with, hair growth, eyebrows you're losing. So I think that's another product that I always have. And then Neutrogena is kind of an unsexy brand that I love a lot of their products, particularly like the Hydro Boost line. Light moisturizers, light sunscreens, really great products, especially for acne-prone skin or people who just like hate using products, or men in particular. And I know you mentioned liking La Roche-Posay. I also love La Roche-Posay. I don't know if it's unsexy product or if it's a sexy product, but I love their facial mist. It's really great to hydrate, to put moisturizer on moist skin. So doing a little mist of that, amazing.
I have this, it's a two-phase like oil spray, and I use it in the afternoon when I don't want to reapply my makeup. My face feels dry and in the wintertime, and I'll just spritz some of that on my face and just kind of pat it in. Then I don't have to like redo the makeup. So I like, that's something that I do. You mentioned minoxidil for eyebrows. Which strength works for eyebrows?
Just don't waste your money on anything other than the 5% minoxidil. Like just 2% is trash. They market that sometimes for women. But yeah, everyone should just be using the 5%. Doesn't matter if it says it's for men, 5% for everything.
If I am going to splurge on something, what is your favorite splurge?
So I guess I'm just going to answer this by saying like the most expensive product that I have and like to keep is this brand called Retrove. They have this eye concentrate that is primarily squalene. It's kind of like oily a little bit, great for like more mature skin around the eye. It kind of just gives this like dewy look, but it also has some other moisturizers in it and peptides and vitamin C. I always get compliments when I'm wearing that. It just, I don't know, it kind of reflects the light. I don't know. I love it. The founder of that is a woman from the Kiehl's family. So anyway, that's probably the most expensive product I have in my bathroom.
All right, that one's going in the show notes, but I have a question. You talk about eye cream. Is there really anything out there that can address puffy eyes?
I mean, caffeine in an eye cream, maybe. I mean, should have some benefit. But I mean, like, I struggle with puffy eyes. I just am not going to lie to people. Like, I just don't think it does much. You could use like all the ingredients I just, rattled off with that oil that I like. I personally like it. It looks good on my face, but all those same ingredients are in a lot of other facial serums or your moisturizer. You don't really have to have a separate eye cream. You can just take all these things up to your lash line and not buy another product. But caffeine, cold things like, gentle, these like things you can put in the refrigerator to hold over your eye, these eye patches that are just cooling, that helps constrict a little bit, but I wish there was an easy answer.
A woman I used to work with used frozen spoons.
Yeah, frozen spoons.
She'd put those in the fridge, and that worked for her. So I was like, whatever works. What about gua sha?
Yeah, I mean, I think that we can have some puffiness in our face, that it's, nice to kind of like stimulate some lymphatic movement. I mean, I think try it. If it works for you, great. I just think it's not a guarantee for anybody.
Okay. It'll feel like self-care. It makes you feel better.
Sure. Like, yeah. Take a minute.
Yeah.
Yeah. Love that part of it.
I want to ask you about this, and plenty of my listeners probably have teen grandchildren. You went viral talking about teens and skincare, and I think you were just commenting on a video, and it went viral. And so can you talk about that a little bit? What are our young girls doing wrong in terms of their skincare these days?
Yeah. So it's funny, like I think the virality of that video had a little bit to do with like the child that I was commenting on, which is just really funny. I mean, I think people think that like, oh, I'm on social media, I know all these people, I stay on top of all this stuff. I had no idea that this was like a Kardashian child. My social team sent me this video and said, hey, this might be cool to comment on. And so I did. And, I had no idea. Like, I was not feeling the best about how, I hadn't done my hair, whatever, I was just like throwing this out there, getting it done. So just very funny because I had no idea that really that's, that this was this child. But anyway, so kids are just, into skincare. I mean, we're just seeing it younger and younger. I mean, it kind of goes along with social media being, so pervasive now. Kids seeing their friends, they're seeing influencers, they're seeing this young Kardashian child on there talking about their routine. So, they're just trying to fit in and want to use these products. And, they're little shoppers and consumers too. I mean, just like adults, it's like shiny product syndrome. You see what you want, you see these things, you want to use them. So unfortunately, with kids, they're using products often that have actives designed for adults. So they're not formulated for the needs of their skin, and they're too harsh for it because kids just have like much more sensitive skin, especially like the tweens. They're not even making much oil, which helps them tolerate some of these things. So I think it's really important to try to educate them on what is right and to kind of help parents understand that. And I kind of saw this whole thing coming. I don't know if you know that I'm also the founder of a skincare line for kids called Between, which we launched in 2023. Like I said, because I kind of noticed this in my clinic, people asking all these questions about how to help their kids deal with what was going on in their skin. And I just wanted something that really encouraged them to focus on the right things, which is just cleansing, moisturizing, and sunscreen, with something that was actually like made for them.
Got it.
And then the other thing that I hate about the whole kids skincare controversy is like most people are not talking about the sun protection part of it. And again, we've talked about this in multiple contexts, but like that should be the major part of the conversation when it comes to kids and how they're taking care of their skin.
Yeah. Yeah. And you don't hear that at all. And interestingly, I think maybe because I follow you, I was in Sephora over the holiday and was appalled at how many really young girls were in there buying stuff. And not that they can't, buy their lip gloss and all that stuff. I get it. But, what really?
Yeah.
And they probably all got Sephora gift cards for Christmas and they were in there, right? And yeah. And they probably didn't get sunscreen in their stocking.
Exactly. So that's where we're like, maybe the conversation will evolve as we start to, this is like continues to be a huge segment of market growth, but I don't know. That's not the conversation focus for even adults, really. We just kind of like learn that that's something that's important. So that's really what my goal is on social, kind of always has been. And then now with like my skin cancer situation, like really trying to like educate people. But the other thing that's really hard is that, when you're young, like you're a teen even, like it's very hard to think about the future, right? I don't want to say I was excited, but I have a good friend of mine, and I know her daughter is a teenager, and she's one of these kids that like chases the UV index, right? And I was like, I was seeing her to help her with something, and I was like, so check out this giant leg scar that I now have, and this is why I try to tell you not to like go out in the sun all the time. And she's just like,
oh gosh, yeah,
it's like, so it's just you got to keep saying it, I think, but we've all been there, and it's just really hard to think about the future like that when you're a kid.
Yeah. Oh, I get it. I did tanning beds. I did all the stuff and shouldn't have, but I'm gonna pay the piper for it now, I'm sure. Just as an aside, where can people find your teen line?
So we sell online. The website is called Meet Between, and it's BTWN. So I sell there and then through my office in Scottsdale.
Okay. All right. Perfect. I'll put that in the show notes. I want to talk about one more topic, and we touched on it a little bit with the Rogaine and the eyebrows, but hair loss is a huge issue. and people close to me, friends. I mean, it's, and I see it in myself and other people. What are the most common causes you see, especially around menopause?
Yeah, I mean, hair loss is a very complicated topic because there are so many factors that play a role in it. Being sure you have like adequate nutrition, hormone changes, your stress levels, all these things. And I think obviously, like around perimenopause and menopause, there's hormone fluctuations, but also those are times when people are like really very busy dealing with careers and, kids and, it's a lot contributing to this. But androgenetic alopecia, which is kind of the patterned type of hormone-driven hair loss that's super common, generally appears around this time. But then also telogen effluvium, which is more of like a stress-induced just shedding, which again, for all those reasons can happen. So I see often one or both of those things. They can definitely be in combination together. So it is really addressing and thinking about all these things when you're approaching hair loss in a middle-aged woman.
Let's talk about scalp health. Are there some things that we can do proactively to really enhance the health of our scalp, that scalp environment?
I do think there are some things, and it's a good point because I am always telling my patients, like, your hair follicles are like little princesses. Like, they need a perfect environment to work. You need to baby them. So we want the scalp in general to be as healthy and like inflammation free as possible. So, being sure that you are managing things like dandruff if you have it. Even if you don't have dandruff, using something like a ketoconazole or a Nizoral is the brand at the drugstore most commonly used to get any of that, inflammation that you might not even really appreciate under good control. I think that's like really important. Being sure that you're washing your hair periodically. I mean, this is a whole other conversation. There's definitely people out there who don't. And if they're getting away with it, fine. But for the most part, you want to be washing at least a couple of times a week to, exfoliate, be sure that there are not dead skin cells clogging up these follicles, and to be sure that you're not having like oil that's sitting there causing some low-level inflammation that then makes your follicles not happy.
When you say inflammation, how would we know if we have inflammation in our scalp?
Yeah, so if you feel sensitive at all, itchy, flaky, it's hard to see your own scalp. But I mean, like when I'm looking at it, sometimes you'll see like someone would see redness in addition to those things that they might otherwise notice too.
Okay, this is good stuff, because there's a real trend out there to wash your hair once a week, and I that doesn't seem like that'd be a great idea, but I guess it works for some people, but
yeah, I mean, I'm embarrassed. I don't know, embarrassed is the right word, but like my son washes his hair once a month. He has been like totally influenced by TikTok, whatever, to do that. And so I am looking at his scalp constantly. And I'm like, this cannot be right. But it's fine. Like, he doesn't have any redness. He doesn't have any scale. I mean, I can't see microscopically. There might be like, some clogging of dead skin cells there, but like nothing that I can see visually. So I'm like, I guess this is okay. Like, I'm trying to point out to him that this can't be right. But I think if you are struggling with hair loss, that would be something I would like amp up a little bit first and see if that has an effect. But it's a crazy trend.
I've been reading about biotin and biotin supplements, and how really only biotin is helpful if you have a biotin deficiency. Is that correct?
That is correct. I hate biotin. It is a huge scam, in my opinion, in the hair care world. Yes, if you have a deficiency of biotin, which is incredibly rare, a hereditary disorder, your hair is brittle and it doesn't grow. And if you replace it, you grow hair, and great. And that's where this all stemmed from, this whole like market. But if you don't have that deficiency, it just doesn't do anything. And it has some negative effects, because if you go to get blood work done, for example, thyroid testing, which is a common cause of hair loss, it affects how that lab is interpreted. So you do want to be sure that if you were on a biotin supplement, that you're off that for at least a week before testing. Most people don't know that. And then the other thing that's even more risky is if you were to go to the emergency room, you're having chest pain, the enzyme testing we do to look for heart muscle destruction is it's interfered with biotin. So I tell all of my older patients, but I mean, I don't know what the age cutoff. This is just arbitrary. Like, no more biotin. Like, so really, just nobody needs biotin.
Okay. What about collagen?
Collagen is, I mean, I do think there's reasonable evidence that it helps keep your skin hydrated. So it gives like a plumper look, but it is not going to your skin and making you have more collagen. I anecdotally hear patients tell me that they feel like their hair feels stronger or their nails, but I don't think there's any like actual studies. There are some studies that show, I mean, small studies, but show that maybe it improves hydration of the skin.
All right. I'm going to keep taking my collagen.
I mean, I take it. I mean, who doesn't like hydrated skin? That's great. But It's not improving your collagen. It is not increasing your collagen.
All right. And then you did mention Nizoral. And so I'm almost tempted just to try Nizoral. I mean, it can't hurt anything, right?
Yeah, why not? Nizoral, it's good because if you do have like a little bit of a dandruff situation going on that you don't realize, then it will get that under control because that would negatively influence hair growth. There also is some evidence that ketoconazole, which is the active in there, acts as like an anti-androgen at the level of the hair follicle. So it can stimulate some hair growth through that mechanism as well. So I think, why not?
Well, yeah, why not? Does it block, what, if I can talk, does it block DHT? Is that?
Yes,
okay.
That's kind of the thought. Mm-hmm.
This is really good stuff. I really like this. Now, let's just talk real quickly about eyelashes because I know there's Latisse, but my eye doctor does not allow me to use Latisse because of the prostaglandins, and I've got dry eye and blah, blah, blah. Have you seen anything besides Latisse that does anything for eyelashes?
I know of, and in my patients recommend some growth factor serums that exist, but I don't know how effective they are in any individual. I do think Latisse is beneficial. However, like you said, it has those risks. Yeah, I'll be honest, I'm not like really an expert in the eyelash growth.
Okay. No, that's fair. That's fair. But again, I can tint my eyebrows, but the eyelashes is a whole different story.
So I do think that you can use Latisse and minoxidil in the eyebrow area safely. I've used those personally to help and recommend that to patients as well.
All right. We just want to keep our eyebrows.
I know.
Because it's, especially, when you wake up in the morning and you're all one color, it's just nice to have your eyebrows that stand out a little bit. So just one of those things. All right. I want to ask you a personal question. What is one of your own personal non-negotiables when it comes to self-care? What do you do for yourself every day?
The non-negotiable that I would say I do every day is my skincare routine. I never go to sleep without washing my face, doing my routine. And, I do try to take a minute when I'm doing it and, relax and breathe. There's other things, of course, that I do, but maybe not daily. So I love yoga as a self-care. I'm a big fan of hot yoga. Of course, I do pretty much walk my dog every day. I enjoy that as a part of self-care. And then exercising and trying to spend time with my family. These are all parts of self-care. Also sleep, like non-negotiable. Very important for me that I have my sleep. I have crafted my schedule around being able to adjust to my own personal sleep clock so that is not interrupted. I think that is crucial for overall health and good skin.
And when you say your own personal clock, does that mean you wake up by yourself without the alarm clock in the morning?
Yes.
Yes. Yes. I've been doing that. And it's amazing. It just starts your day off so much better.
Exactly.
right?
Yes.
Yeah. Yeah. This has been such a great conversation. We could talk all afternoon, but we can't because I know you got to get back to doing what you do. But Dr. Brooke Jeffy, thank you so much for being a guest today on Asking for a Friend.
Thank you so much. It was great chatting.
Before you go, thank you for being here. If you want to go a little deeper, make sure you check out the show notes for this episode. That's where I link anything we mentioned, resources, partners, or tools I actually use and trust. And if you're not already on the Asking for a Friend community newsletter, that's where I share practical midlife tips, favorite finds, recipes, and the things that don't always make it onto the podcast or Instagram. You'll find the link to join in the show notes. Take care, and I'll see you next week.